Hello everyone, welcome to our instructional video on how to insert a nasopharyngeal airway, commonly known as NPA. So friends, this is fourth video in our basic life support BLS series and I hope you have already watched our previous three videos. If not, do watch them now to have a better understanding. So friends, nasopharyngeal airway, it's a flexible tube inserted through the nostril into pharynx to maintain an open airway. It is often used in patients who are semi-conscious or have a active gag reflex. If the patient is not having gag reflex or patient is fully unconscious, then I have discussed already in my video on how to insert the Goodell's airway. Then in that situation, that patient is fully unconscious or is not having gag reflex, then we will prefer Goodell airway. Otherwise, in semi-conscious or patient with active gag reflex, the nasopharyngeal airway is a better substitute. And also, the nasopharyngeal airways better or more useful in cases of oral trauma in which the oropharyngeal airway cannot be used. So in those situations, the nasopharyngeal airway is a very good alternative. The next step is how to choose the correct size. So the nasopharyngeal airway should be as long as the distance from the tip of the patient nose to the earlobe or the angle of jaw as being demonstrated here in this video, and the diameter of this NPA should be equivalent roughly to the patient's smallest finger. In contrast to the Goodell airway, the distance is distance is measured from the tip of the nose, while in Goodell airway we measure it from the angle of the mouth. And as I have stressed upon in all my previous videos, that in such kind of emergency situation, don't forget to activate the emergency response team or call the 911 to get the expert help. For inserting the nasopharyngeal airway, lubricate the airway with the commonly available water-based jellies like Gylocan jelly, which will be available. Position the patient's head in a neutral position. So normally we always tilt the basically forehead back and lift the chin. In this situation, we keep the patient head in neutral position. Then hold the cut end or the beveled edge of the NPA toward the nasal septum, toward the basically center of the nose, and gently insert with the help of slight twisting movement. Follow the natural curve of the nasal passage and advance slowly and steadily. If you encounter any resistance, try a different angle or you can try the other nostril also, as being demonstrated here in this video. Once the nasopharyngeal airway is in position, then you can start ventilating the patient and start monitoring. Inserting a nasopharyngeal airway, it is a fundamental skill for any medical student in the airway management. Remember to always choose the correct size, use adequate lubrication, and monitor the patient closely. With practice, you will be able to perform this procedure efficiently and safely. And despite all the efforts, if you are not able to secure the airway with the nasopharyngeal airway, then other method of airway securing like the endotracheal tube or the emergency tracheostomy has to be considered. So thank you very much friends. I hope I was able to add some new insight to your knowledge. Thank you for watching. Stay tuned for more instructional video, and all these videos are also available as free content on our app. Do download the app available for Android and iOS. That will act as a ready reference for anybody who is doing basically giving basic life support, because all these videos may get lost in the mumbo jumbo of the YouTube. So stay tuned and thank you very much.